Do you see Kathy or Rocky?
Vice Admiral Bono, sound check.
I see her. So she's not clear. She didn't get a phone call.
Okay, everybody's in.
Hey, this is Kathy.
I should just go ahead and take it all.
You talk as it is.
Can y'all hear me?
So you're on your computer.
Yeah, but I didn't get a call.
Yep. Everything's good. We're about to start off.
Yes, you need to put your phone on computer on mute.
Good afternoon, everyone. This is Corey Portner here from the Joint Information Center. This is our Tuesday, April 7th, COVID-19 update. Today, we'll be joined by the COVID-19 Health System Response Manager, Vice Admiral Retired Raquel Bono, MD, as well as Secretary of Health for Washington State, John Wiesman, State Health Officer, Dr. Kathy Lofi, and Chief of Staff for Governor Jay Inslee, David Postman. To start off our agenda today, we'll be opening up with Vice Admiral Retired Rocky Bono.
Very much. One of the things that I wanted to be able to cover was some of the preparation that we've done for any kind of surge and determining our surge capacity. And working across the Washington State Hospital Association with all the different networks, as well as each of the individual hospitals, we were able to assess the capacity and the capability that each hospital had based on their beds, their acute care beds, their ICU beds, as well as their ventilatory status or the ventilator status. And in assessing that, when we had run some of the models previous to this weekend, we had assessed that we had sufficient capacity in our hospital beds as well as our ICU beds, but there may have been a delta in available ventilators. However, we were able to identify that within the state, we had about 1,000 ventilators available. And by looking at the ambulatory surgery centers, we had an additional 500 ventilators that we could bring to use if needed for any of the patients who needed some ventilatory support. At the same time, we had already initiated our procurement for about 354 ventilators and an additional 800 ventilators. The delivery of those are expected in the next couple of weeks. So overall, even with the new numbers that we're seeing, we feel very confident that across the state, we have the capacity that we need. And right now, as we're assessing the data and assessing where our COVID positive prevalence tends to be, we are making sure that regionally, we have sufficient capacity in all parts of the state. So right now, this is a good opportunity for us to continue our work to make sure that we're optimizing our resources and the capacity across the state of Washington. Thank you.
All right, thank you, Rocky. We are going to move to Secretary Wiesman.
Great, thanks. We know that there's been much media interest and public interest in personal protective equipment, or PPE. As you all know, PPE, that is N95 respirators, surgical masks, face shields, gowns, and gloves are in very high demand, and that demand currently exceeds available supply. Generally, healthcare facilities first order from their usual suppliers or look for other suppliers, and if they can't get adequate quantities of supply, then they turn to emergency management for assistance. As a state, we are using a number of strategies to reduce the demand for use of PPE while they are in short supply. These include stopping non-urgent surgeries and dental appointments, encouraging the use of telemedicine, and employing conservation strategies of PPE, such as not changing out N95 respirators or surgical masks between every patient, but discarding them if they become soiled. Standard practice would be changing them after each patient encounter. The state has been hard at work finding suppliers for these materials from all across the globe, as you've heard. Following leads are coming in from many, many sources. We have been having some good success there, and we're really pleased with that. For example, we have 31.6 million N95 masks on order and 33 million surgical masks on order as well. Some supplies like gowns and gloves are harder to come by. We are targeting orders for 6 million N95 masks, 24 million surgical masks, 18 million gowns, and 108 million gloves per week for 12 weeks. In order to tap into the many of the supply chains out there, we needed to commit to a set order every week through June. That really is how competitive right now the market is for these products. Currently, we have on order a total of 84 million items. In addition to the items that are already mentioned, other items include biohazard waste bags, hand sanitizers, stethoscopes, and ventilators. Since March 16th, we have shipped to healthcare providers across the state 2.2 million items, including 393,794 N95 respirators, 664,600 surgical masks, 873,690 gloves, and 67,610 face shields. In our warehouse right now, we have 3.8 million items that are being processed for shipment yesterday, today, and tomorrow. This includes about 554,000 N95 masks and 782,000 surgical masks. The N95 masks are being prioritized for our hospitals and the surgical masks for our long-term care facilities. I know there's been interest in how much of our supply has been from the Strategic National Stockpile and from donations. Of the 6 million total items received to date, 591,720 were donated items, and 1,526,438 were from the Strategic National Stockpile. Given the tight supplies for PPE, we've created 4 tiers for prioritizing PPE. The highest priority tier, Tier 1, includes hospitals, including psychiatric hospitals with confirmed or suspected COVID-19 cases, EMS and first responder transporting confirmed and suspected cases, long-term care facilities and hospice centers with confirmed and suspected COVID-19 cases, alternate care facilities with confirmed or suspected COVID-19 cases, all hospitals for emergent surgeries and TB patients, and all public health agencies for outbreak investigations. These guidelines with the other tiers as well are on our website at doh.wa.gov and linked to coronavirus from our homepage. During these initial weeks of standing up the procurement and distribution system, our priority has been getting product, accounting for it, working with the public health and healthcare systems to find out who needs the product, and getting it out. Earlier today, we put on the website coronaviruswa.gov this listing of our PPE supplies, which has the numbers on there that I just gave you. So when you go to that website, you can click on the tab, How You Can Help, and there, as you scroll down the page, you will see that inventory. Again, we want to remind folks that the stock we have is intended to fill the gaps that the healthcare providers themselves can't get through their supply chain or the pieces of PPE that the state needs for its work. And with that, I will turn it back over to the moderator.
Thank you. Next, we will move to State Health Officer Dr. Kathy Lofi.
Well, good afternoon, everyone. This is Kathy Lofi. I'm the State Health Officer at the Department of Health, and I'm just going to talk briefly about the status of the COVID-19 outbreak here in Washington. First of all, and most importantly, we do continue to flatten the epidemic curve in Washington, which is great news. But we can't let this news make us complacent. We need to continue our efforts to stay home and stay healthy, or else we will likely see a big jump in COVID activity around the state. To date, we have identified 8,682 confirmed cases, and unfortunately have had 394 deaths from COVID-19. Last week, we had an increase in the number of COVID-19 infections that were detected without an increase in the number of tests performed, and the proportion of positive tests were a little bit higher. We also saw a flattening of the graph that shows the proportion of people hospitalized with symptoms consistent with COVID-19. Unfortunately, we do continue to see a large number of COVID-19 outbreaks in long-term care facilities. As of April 5th, we had identified 126 long-term care facilities with residents who were infected with COVID-19. Many people are probably wondering if we are at or close to a peak COVID-19 activity in our state. And unfortunately, it's really difficult to know if we are at peak activity. We generally do not know that we have peaked in the state until we see about a 2 to 3 week decline in all of our data indicators. And we have not seen that yet. People are probably also wondering about future COVID activity and what this might look like. This is also difficult to predict because it's largely dependent on how well we continue to maintain social distancing practices. Most of the population is still susceptible to COVID-19 or is not immune yet to COVID-19. So if we let up on social distancing practices, we will likely see an increase in activity. So in closing, I just want to remind people that it's extremely important for people to stay home if they get sick. People who are sick with symptoms of COVID-19 like fever, cough, fatigue, or shortness of breath do need to stay home for at least 7 days after their onset of symptoms, and 72 hours have passed since their recovery, which is defined as a resolution of fever without the use of fever-reducing medicines and improvement in respiratory symptoms. Also to remind people, people who are living in the same household or who have been in close contact with someone who has confirmed COVID-19 also need to stay at home away from other people for 14 days after their last exposure to the person with COVID-19. So with that, I'll go ahead and turn it back over to the moderator.
All right, thank you, Dr. Lofi. Finally, we will move to Chief of Staff David Postman.
Thanks, Raquel. I'll be brief so we can get to your questions. I just want to stress the importance of the purchasing and distribution of the PPE. This is one of the very top things that the governor spends his time on, and that's everything from cold calling companies, CEOs, to see if either A, they have supplies, or B, if there might be somebody who can manufacture something that today they don't manufacture. He issued a directive on April 2nd to Chris Liu, the director of the Department of Enterprise Services, and Robert Ezell, the director of the Emergency Management Division, and the subject is personal protective equipment purchasing. And essentially, it's a very brief thing, but is an official recognition of how hard we have to go on this, how aggressive we need to be. And in this, he addresses DES, which is our purchasing agency. It says DES is authorized to take appropriate risks in fulfilling these emergency procurement goals that would not otherwise be acceptable outside of this emergency. We just wanted to put it out there for the agency heads. These are people who obviously are very conservative stewards of taxpayer dollars, which they need to be. There's frankly some scams around PPE flying around, and we're working very hard to vet those. But the governor also wanted people to understand that in an emergency situation, we may not be able to do everything exactly how it happens in the quiet of the regular turn of business. So he just keeps pushing for more orders to get that steady flow in, as John Wiesman pointed out. And then we need to make sure they're getting from our warehouse out to all of the facilities around the state that need them. Thanks, Corey.
Thank you. Okay, now we'll move into Q&A. For this, we had a number of folks queue in for questions to ask during the briefing. We will begin the list with Hannah Scott, Iowa Radio. You should be unmuted.
Hi, everyone. Thank you. I'm wondering if someone, probably from the health department, might be able to speak to this. Are there any discussions at this point or efforts underway as far as planning for down the road after we're through this particular wave to get to the point to where the restrictions could be lifting? And what I mean is, what do we do, like antibody testing, ability to isolate and contact trace with that? Are we talking about that, and where are we with that?
Thank you, Hannah. We are unmuting. Right now.
This is John. Can you hear me?
Yeah, John, loud and clear. Thank you.
Oh, great. So yes, we are looking at that in terms of what needs to be in place as we begin to think about the time when we would be past the peak and we would essentially have very few cases being identified. So there are a number of things that we know have to be in place. First of all, we need to have sufficient personal protective equipment to make sure that our healthcare providers and others can practice safely, which is obviously something we are
John, this is Corey. You cut out there. Are you still connected? Okay, we'll try and come back to Secretary of Health here shortly. We'll try and get his answer. We'll route that back around. Apologies, Hannah. Next, we will go to Mai Huang with Yakima Herald, I believe. You should be unmuted.
Hi, thanks. Thanks, everyone. I think this question is for Dr. Bono. I wanted to get an update on the Astria alternative care site, and I also specifically wanted to ask about staffing. I know that there are 80 health corps folks setting it up, but obviously, if you're looking at a patient load of up to 250 patients, I imagine there would be additional staffing that would be needed, and I'm curious about procuring that additional staffing. Thank you.